You're listening to Healthcare Heartbeat, brought to you by Avant Healthcare Professionals.
Happy New Year! Here we are. Happy New Year to you.
Can you believe it's 2024?
I cannot, Marisa, believe it's 2024. It's absolutely crazy. It just seems like the other day, not a year ago, that you and I were here welcoming everybody to 2023.
I know. On my first Facebook Live.
Wow, that was your first one?
My first one. I know you're a veteran. All over Facebook.
Oh, over Facebook. I wouldn't say that.
Yeah. And here we are doing our first podcast.
Yeah,
Avant's first podcast.
This is amazing. It's to have a new forum and platform to be able to speak with all of you is just so exciting.
Yeah.
And I listen to podcasts all the time, so I never thought I would have the opportunity to listen to myself on a podcast.
I know, and now here we are hosting the first one, kicking off the new year.
I know.
There's so much to think about in 2023. And I can't wait to share all the stories of what we've seen, how we've shared, how we've impacted lives.
Yeah.
But first, let's welcome our listeners. So welcome to Healthcare Heartbeat, Avant's first podcast of the new year of 2024. We look forward to sharing all sorts of information with you throughout the year and the years to come relative to healthcare professionals looking to become a USRN, to executive leadership at hospitals, and where we can share how we can be a solution to some of the challenges that they're facing in their own workforce. So my name is Marisa Zaharoff. I'm the president for Avant.
And I'm Lesley Hamilton, and I'm the Senior Vice President of Operations here at Avant. So do you want to talk a little bit more about how you came to Avant and kind of a bit about your background?
Sure, absolutely. So for those that don't know, I'm actually an RN by trade, but it's been a
hot minute,
couple decades since I've practiced at the bedside. I've spent most of my career in healthcare staffing, more on the domestic side. And a little over 2 years ago, I joined Avant, and I couldn't be more proud of the organization, the mission, how we serve the communities across the nation, and how we impact the international nurses' lives and therapists' lives. It's truly amazing. And you have been here practically since the inception.
Since I was born, nearly since I was born. Yeah, I've been with Avant since 2006. So coming up, I think that's 19 years. This January 1 is actually my, January the 1st is my anniversary here at Avant. And I also am a registered nurse. I did my nursing training in New Zealand. And shortly after that, really because of a boy, I came to the States to work as an international nurse. The boy didn't last so good. That wasn't good, but the career has been a good opportunity. So I've been an international nurse and have been with Avant now, as I said, since 2006. And, you know, looking back over the years, so much has changed.
So much.
It's been unbelievable. But I think the core things that still remain is really, again, as Marisa said, the lives that we change, the opportunities that we provide for nurses, physical and occupational therapists to travel all around the world and to the US particularly. And I think also the service that we provide to clients and the communities that those clients are in. It's another way that we're so proud to have been able to change lives. So that's us. And but I guess really before we talk a little bit more about Healthcare Heartbeat, I think we're going to talk a little bit about the nursing profession now.
Yeah, absolutely.
And going into 2024.
2024, yeah. I think that, you know, there has always been a critical shortage of nursing in the United States. That has kind of been the common thread, and trying to find solutions and opportunities for clients to provide an additional workforce or to boost or build their own nurses has been a challenge.
Yeah,
so,
and I think we're not only seeing it now in the U.S., but we're seeing it globally.
Yeah.
and I think that's one of the big changes over the last, certainly the years that I've been here. We now are seeing shortages of nurses in first world as well as third world countries. And, certainly the US leads that, I think, by virtue of the size of our population and the amount of healthcare delivery that goes on in the US. But it is something that we are seeing global now, with a global shortage of nurses. And I always say to people, particularly younger people than me who are thinking about a profession, being in healthcare is kind of a slam dunk. It's a very safe profession to be in. It's very secure. You're never going to be without a job. And so if you have family members, maybe nieces, nephews who are looking for a profession, I know Marisa would certainly recommend looking at nursing as an option.
Absolutely.
Right?
And it's so personally fulfilling. Right? To be there at the most and share the most vulnerable moments of a person's life, right? So. And
I think now so diversified.
Absolutely.
There's so many avenues in nursing that you can go into. And so certainly, nursing gets a recommendation from us. For
Two
sure.
thumbs up.
2 thumbs up.
For sure.
And I think as we look at the nursing crisis, there's many, many factors that are influencing what's happening with the nursing shortage and why that shortage continues. And, I think one of the sad things for me is the number of nurses that are choosing to leave the profession. I think, as we all know, COVID took a toll on many, many healthcare professionals.
Mental health
of healthcare professionals, and nurses being part of those frontline workers, I think particularly bore a huge burden during that time. And, unfortunately, I think that's led to many nurses leaving, really leaving the profession and moving into other maybe non-patient facing areas of nursing, leaving nursing altogether to go and do other things. And, again, we obviously both left the bedside aspect of nursing, but I still very much feel like I'm involved in the nursing industry because of what we do.
Absolutely.
So I don't feel like I left nursing. I feel like I just did a slight detour and adjacent profession. That's a great word. What are some of the other things that you think are impacting the shortage?
Retirement.
Yes.
For sure. So I think the last review I read, 54, 55. Retiring, that's the average age, right?
Wow,
so think about that.
Right.
Closer and closer as the nursing population ages. And just the physical toll and mental toll it takes on people, right?
I now, I think about nursing now on the floor.
Oh, so
I'm
different.
not sure I could do it.
Yes.
I don't think
yes.
so. But I think, as Marisa said, the average age of a nurse is increasing.
Absolutely.
And so as that happens and we don't have enough younger nurses coming in at the lower levels of the profession, that's leaving a significant gap. It really is leaving a significant gap. And so I think that also is having a huge impact. And I think the other thing that is really important to talk about is the fact that we don't have enough educators. We have people lining up to go to nursing school, and yet we can't admit all of those people into the places that are available because we don't have nursing educators to educate the people that want to go through the nursing program. So that also is something, that as a country we really need to take a look at, I think.
I think that when I think about nursing as a whole, I consider 3 potential solutions. So, looking at the delivery of care, the nursing model. We've seen so many different models over the years, whether it be team nursing or, individual where you have some aides, but it's not a team. Like there's different models, right? Primary care, So you have that. You have technology. Technology's played a huge made a huge difference. Think about the electronic medical records. Remember charting on paper?
Oh my gosh,
on paper, you're like,
absolutely.
Awake, alert, oriented, times 3. Exactly. All of that, right?
And now we have robots in hospitals delivering medications.
Yes.
We have food deliveries, all
Yeah.
kinds of automation now going on. Tracking of patients through the hospital with the as you say, the EMR as well.
Virtual cameras, checking in,
virtual assistants. Yeah.
All of it. It's incredible. And then the last is bodies, people.
Yeah.
Right? And I think about, what is it going to take to create the additional workforce, right? Especially when you consider the global population is decreasing, right? There aren't enough workers in general, right?
Yeah.
And to your point earlier, people aren't selecting nursing. Right? Or healthcare in general. Right. And that's a scary thought for when we actually do retire.
Yeah, I know. Absolutely.
Years from now. Like, what is that going to look like? So,
and I think, the things that you raised there, all of those things need to come together in order for there to be an opportunity to have an impact on the shortage. I mean, we go to DC on a regular basis and, the shortage is very much top of mind.
Absolutely.
For
in Congress.
Everybody. In Congress, in the Senate, everybody. And so, it continues to be something that we really have to work on. Yeah. I think too, as with the shortage and with there not being enough nurses on the floor in many hospitals, it takes a toll on the individual, on the individual nurse. And so certainly, increased workload, higher patient ratios. One of the things that we hear a lot about now is, again, as we mentioned before, burnout, the toll that it takes on an individual's mental health.
The acuity of the patient, dramatically different.
So different now. And I think about, some of the patients that we used to take care of. And I think now the acuity of those people coming into the facility is so much higher.
Absolutely.
Sicker, they're discharged quicker, require more care. And, and not to mention some of the things that, happen around. We've read a lot about violence towards nurses, which for me is, completely unacceptable, but something that is a very real situation that nurses and healthcare professionals experience and should not have to when they are working to care for our loved ones and people that come into that environment. So many, many things that are affecting and impacting, nursing as a profession now. And, just hats off to those of you who are working in the profession. Thank you for your commitment. And, we couldn't deliver care without you.
No, absolutely.
So just huge gratitude to all of you who are listening and joining us today, who are working actively in the profession.
Yeah. We know it's a challenging problem. We know that it's going to take a village. It's going to take all of us across the U.S., across the globe to help fix and solution the issue, not only that we face, but also globally. So you mentioned before as far as the global issue or impact, and I think the last article I read, it's over 13 million nurses short globally.
That makes you take a breath. That makes you take a breath.
Yeah.
My goodness.
So we're facing a 1 million nurse shortage, but globally 13 million.
Yeah. Wow. So on that note, let's take a little break, shall we? And we'll be right back with Healthcare Heartbeat.
Are you tired of dealing with staffing shortages in your healthcare facility? Let Avant Healthcare Professionals help. Our partnership provides skill-matched, globally educated healthcare professionals who provide positive patient experiences and exemplary clinical quality. In fact, over 90% of our healthcare professionals convert to our clients' full-time staff. Too good to be true? It isn't. Here are just some of our satisfied clients.
It's a win. It's a win for us because we were able to, help with, our staffing needs, but we were also able to add value to our team of nurses that are there. We have a diverse team of nurses that are available to take care of patients that speak a different language. They just really add value.
Why would you not hire a nurse from Avant? They brought extraordinary heart and soul to our unit and our facility.
So what are you waiting for? Go to avanthealthcare.com/podcast or click the link in this episode's description to start the process in solving your staffing problems. Avant Healthcare Professionals.
Welcome back, listeners. If you were with us at the top of the podcast, we shared a little bit about ourselves, our backgrounds, and our excitement over what we do at Avant and the lives that we change.
So, just so you know, if you don't already know what we do at Avant, we are a company that works predominantly with international nursing professionals, also therapists as well. We certainly are open to Americans that would want to join our program as well, and we do get inquiries locally and domestically as well. But the main core of our business is helping international healthcare professionals move to the USA. And, really, I know the mission is something you're super passionate about.
Yeah, I think that was the big draw to the organization, right? Was, changing lives. Yeah. Making an impact, improving someone's future, right? Yeah, so thinking about the healthcare professionals, their families, our clients, and the communities and the patients that they care for, right? And then also our own associates in our corporate suite, right? They're as important because they're making it happen each and every day.
And we're fortunate to have a great team here at Avant.
Incredible.
And you'll get to meet some of those as we do future podcasts.
Yeah.
Now, last year, 2023, was a big year for us. It was our 20th anniversary.
Where's the champagne?
I know. We should have had something other than coffee to drink this morning. So Avant started in July of 2003. So July of 2003. So 2023 was our 20th anniversary, and something that was long awaited and very much celebrated.
Huge celebration.
We've gone through a lot of change at Avant. We've not only grown significantly over that 20 years. We talked a little bit in the first half about the number of countries that we recruit from, over 70 now and growing all the time. I think, when we first started, the locations that we had to offer were very limited, and now we place in over 40 states. In the US. We serve clients in over 40 states, and we have opportunity for our healthcare professionals in that same number. So, there's been so much that's changed, and so many ebbs and flows in the industry. The one thing that's constant has been change. Change and challenges. And most of the challenges have come pretty much with immigration. Usually that is something that changes over the years. But, those immigration challenges and the other challenges we face have never stopped us.
No.
If
find
one
a way around,
for sure, we
up,
find
under, around, we're going to get there
through.
for sure.
And we look at challenges in a different way here, and it really is, how do we overcome them? And this year is going to be no different, I'm sure. No different.
I agree. I think about the lives. You brought up changing lives. I think about when we recorded on Facebook Live a year ago, 6,000 lives over the last 20 years of clinician lives, plus their family, their extended family, right? And the futures that they're building, and over 20 million patients.
Wow, that's amazing. I get goosies
I know.
when you say that. That's amazing. That's amazing. It is a testament to the program that we have. I think it's a testament to our own associates, again, to the faith and trust that people have put in Avant over the years. And we're thankful for the healthcare professionals and clients that have trusted us, with that process and really given us the ability to grow. And we've had to change. We've had to continually update information that we provide. We have a wonderful clinical and cultural program that helps the assimilation of our nurses into the healthcare workforce here in the States. That has to get updated on a regular basis. NCLEX changed last year as well. So NCLEX, the licensure exam for nurses to come into the U.S., had a huge change in 2023. And so our whole NCLEX review program that we offer also had to change. So, change is certainly a constant here, and something that I think we love. I think if you don't have change, it gets a little dull sometimes.
Yeah, no, it's always, you're looking for another solution, right?
Exactly.
Problem solving, critical thinking, right?
Yeah, employing all of those things that we need. The year last year was not without challenge. We've had, as always, in international recruitment, some immigration hurdles.
Yeah.
Retrogression did happen. We had several years of very easy movement with visas, really because of COVID and the fact that the embassies were closed, visas were not being used, and so there was an oversupply of visas that made it much easier for us to bring in much higher volume of nurses. And so the last couple of years has been very rewarding in
smooth
that
sailing,
respect.
right? Smooth sailing right through immigration.
And then come the middle of 2023, things slowed down again.
Yeah.
But the great news is we continue to recruit. We continue to work with nurses and clients to make that match happen and bring nurses into the country. We've been forced to look at other opportunities.
Diversification.
Absolutely. Yeah. So more to come on that as we film these podcasts throughout the year. But retrogression has never stopped us. And is not going to this time either. And last year was also a special year because we started looking at our sustainability goals.
Yes.
And we started a global impact division. So you want to talk a little bit about some of the things they've been up to?
Sure.
Yeah.
So I think that this is very close to my heart.
Yeah.
Just with, it's one thing to give and provide a better life for those that are seeking it, right? But it's another thing to give back to the communities and the countries where we recruit from, right? And I think you have to look at healthcare from a long-term perspective. So as nurses and other clinicians leave their home countries to build a future, we need to do something to provide sustainability.
Absolutely.
So we launched our Dream,
Become
and Inspire scholarship program,
yes,
right?
We did.
So we are providing nursing scholarships and our first kickoff point was Kenya.
Yeah. More to come.
More to come.
More to come, more countries to come. But we had a wonderful opening to the scholarship program.
Yeah.
People had to provide a video essay and talk to us about why they believed they should be included in that scholarship program. And we showed some of the video essays at our recent town hall. I don't think there was a dry eye in the house.
No.
So it really was a privilege to see these young men and women, embrace the opportunity that we've made available. So excited to see more to come.
Yeah, we also partnered with a primary school.
We did.
And we provided, I know, the photos. We provided backpacks and school supplies and taught basic first aid.
Yeah.
So our in-country clinicians waiting to join us here in the U.S. provided first aid instruction.
That was amazing. I mean, to see them, these are nurses that are in process to come into the U.S. with us, and to see them have the ability firsthand to work in their communities and be part of that initiative was just incredible. Absolutely amazing. And then we also have been working with medical clinics, both in the Philippines and in Kenya, and again, more countries to come. So I think, you've certainly led the charge for the organization with this sustainability goal. And as you said, it's something that's very close to your heart. And so this coming year is going to be, really exciting to see
even better,
that.
Right?
Absolutely.
Giving back is so important.
Absolutely. So we will keep moving forward.
Yeah, I'm really excited. Last year, I took my first trip to the Philippines.
Yes, you did.
And now we're building out our office space.
Yes. And not only did she take her first trip to the Philippines, but she ended up on national television doing an interview while we were there.
TV Patrol.
Yes, which was pretty cool. But our office in the Philippines is currently under renovation. But it will be open, what we hope, in February, March of next year. So you'll be able to come and, if you're in the Philippines, in Manila, you'll be able to come and meet us in person. Another thing for last year was that we now have an office in Kenya.
Incredible.
Amazing. In Nairobi. So if you're based in Kenya, you can meet with our team there.
Stop by and see us.
Stop by and see them. So, and really more to come, more travel this year, different countries, more opportunity for you to meet with us in person. So what else are we going to be doing with Healthcare Heartbeat? Like, what other topics are we going to be covering?
There are so many topics, Lesley. What? So anything from recruitment, how to apply,
Yes.
right?
Yeah.
You know, there's a website. Where do I go? How do I navigate the process? What do you need from me? What are the documents? I know we're covering that. Immigration. You covered a little bit of retrogression. I think.
Yeah.
So coming from the domestic side of staffing, international, and all of the steps that you have to take to actually file the paperwork, get accepted, go through the visa screening to arrive.
Yeah.
I would have never thought. In a million years.
A lot. It's a lot.
I don't think that was part of the onboarding process prior to. So when you think about domestic travelers or local contract clinicians, you apply and you can get a job within, a couple weeks, go through all your screening, your documentation, and arriving at Avant and learning it takes minimum 2 to 4 years.
Yeah, long
I
time.
mean, just think about the length of the relationship.
Yeah.
So I apply today, and in 2 to 4 years, I arrive in the U.S.
Yeah.
The commitment
It's
that these
unbelievable.
folks have is just incredible.
So we'll be walking through that process. We have great associates here at Avant who love what they do, who are subject matter experts in their own fields. And so they'll be sharing podcast information on Healthcare Heartbeat in the months to follow. Also our clients.
Yes, thought leadership.
Thought leadership, absolutely. I know that's something you're also pretty passionate about. So we look forward to having dialogue with clients, with healthcare executives who are important in the industry, and also sharing with clients some staffing and retention strategies that may be helpful for you as you're managing your own workloads and your own workforces. And I'm excited to share, at some point, we're going to share some success stories of nurses and clients who've been through our program, who've been with us. There's nothing like hearing somebody else's experience to be motivational and inspirational.
Absolutely.
And so that's going to be a large part of what we do here on Healthcare Heartbeat as well.
Absolutely.
So,
is that a wrap? Do you
almost,
think?
I think. Almost a
So,
wrap for our first podcast together.
Hey.
Cheers again.
Cheers.
Absolutely. Well done.
Right. Nothing like, and again, a year ago we shared coffee.
But we had
the motivator.
We had hats and poppers last year, so we're a little subdued this year, but still a great way to start the new year off.
Absolutely.
And you can subscribe wherever you get your podcasts. And make sure if you are an international healthcare professional or a client seeking international nurses, we have a wonderful website you can go to, avanthealthcare.com, and you can apply. You can send us a message through Facebook. We're also now on TikTok,
Instagram, you
what
name
else?
it.
You name it, we're on it.
We got
really.
it.
We got it. YouTube. Yeah, we got that covered too. We got that covered too. So certainly connect with us. The success of this podcast is going to be your interaction with us as well as our interaction with you. And we really look forward to sharing more over the coming year.
Thank you so much for listening. We hope that you enjoyed our first podcast. Check that box, right?
Check that one off.
And look forward to having you tune in the future. Thank you so much. Have a
care.
Great year.
Have a great year.
Cheers.
Happy New Year
2024.
Again. Yes. Take care, everybody.
Thank you.
Bye-bye.
Thanks for listening. This has been Healthcare Heartbeat by Avant Healthcare Professionals, the leader in international healthcare staffing and recruitment, where we change the lives of healthcare professionals every day. To learn more about how our healthcare professionals can help your facility, visit AvantHealthcare.com and be sure to subscribe to this show wherever you get your podcasts.